One of the greatest challenges facing COVID-19 vaccine developers and governments is getting the actual doses to people. Distribution involves refrigeration, fragile vials, raw materials that need to be transported across countries and into clinics, pharmacies, and hospitals. For China, it's the logistics of vaccinating more than 1 billion people twice.
For months, China has been ramping up production of hundreds of millions of doses, with at least 3 of the country's leading vaccine candidates still in late-stage trials. The idea is to have enough doses ready to roll out when the vaccines are approved by Chinese regulators, which for state-owned China National Biological Group should be soon. Yang Xiaoming is the CEO of CNBG. He says, "We hope that this vaccine can be used by the general public by the end of this year."
So we're talking weeks, not months.
Yes, he says. That vaccines have been developed at such a speed is a scientific achievement. Getting them to people is a massive feat in logistics. In China, big delivery companies like SF Express have built up entire pharmaceutical units, equipped hundreds of transport trucks with refrigeration units, special boxes, and cold storage vaccine shelters that can avoid power outages or contamination over long distances. The IT system will be able to promptly detect and solve problems, he says. We can then check and track the process. Those vaccine supply lines then go to hospitals, clinics, and medical centers in cities and rural areas. A recent pilot project in the province of Zhejiang invited people to register for a vaccine using a mobile phone app. People were told they'd get an appointment notice by text message to avoid long lineups for limited supplies. Nearly 1 million people in China alone have already been injected with yet-to-be-approved Chinese vaccines under the country's emergency use campaign. So healthcare workers, military, government employees, food handlers, they've had it already, despite safety concerns by scientists in the West about any long-term effects. Students wanting to study overseas in countries where the virus is still rampant are eligible to get vaccinated for free. Outside of China, Chinese vaccines are in late-stage trials in Brazil, UAE, Turkey, Indonesia, Bangladesh, countries where the infection rate is still high. They'll get priority from Chinese companies like Sinovac, it's privately held, and Sinopharm, another state-owned biotech that says it has orders from over 100 countries. None of what China is doing is being coordinated with the U.S. It's like parallel universes. China also joined COVAX, the global vaccine delivery program organized by the World Health Organization and other groups. It doesn't yet include the U.S. The initiative is about ensuring equal distribution of vaccines, but COVAX won't be able to get supplies to developing countries until late next year. That's opened an opportunity for Beijing and what's called vaccine diplomacy, which is basically a form of soft power. In China, nearly all of the companies and labs with vaccine candidates are state-owned, and there's military involvement too, so the government has a say. In September, Xi Jinping announced that China considers vaccines a global public good. Chinese vaccines will be made available to poorer populations at a lower cost. Latin American countries are receiving $1 billion in loans to buy doses, and Bangladesh will get thousands of them for free.
Ideally, vaccines are going to come from different companies working in different countries that are going to roll them out around the same time. China says it will make its vaccines available to the world. Being able to deliver on that could bring some prestige and maybe an end to the spread of the virus.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.